Should you prepare for your council exams by reading textbooks, or should you just stick with past questions? This question, I have had to answer it a dozen is even an understatement. I can't even count how many times I have had to answer these questions from my students and followers. So in this video, I think I'm going to be doing justice to this particular statement. So stay tuned. Hi and welcome back to my YouTube channel. If you're here for the first time, hi, my name is Busari Malayo. I am a Nigerian registered nurse and midwife. I'm also a United Kingdom registered nurse. On this channel, I talk about nursing, healthcare, and sometimes my lifestyle generally as a nurse. So if you're interested in content like that, do click on the subscribe button down below, somewhere down below, and like this video so YouTube knows that the video is interesting and pushes it out to other people who need the video. And alright, so let's get into it. So the nursing council exam, as we all call it in Nigeria, or should I say the nursing board exam, as a lot of nursing students in other parts of the world would call it, is your final examination, and it is basically a compilation of questions from different areas of nursing that you have done all through your training, be it 3 years training, 4-year training, 5-year training, depending on what curriculum your country has set. And these questions, they cut across everything from the first year to the final year, and you could be asked in any form, any way, theory, objective, practicals, so many things. So when people want to study for these exams, they usually start studying probably towards the end of their program, and it brings the question, should I just stick to reading topics from my textbook, which obviously are very voluminous and they are widespread, or should I just stick to past questions and practice questions from previous exams or previous years? Which study method is actually the best? I am going to be answering this question based on my personal experience, okay, and some experiences of my friends and students, and to see which way is best or how best it is to approach this situation. The first thing you need to understand is that you do not start preparing for your nursing board exam or your nursing council exam 3 months or 4 months before the exam. If you have zero knowledge about nursing to 4 months before your exam, you shouldn't even be preparing. Okay, so your exam preparation actually starts from the first day you enter that program. Like the first day you started saying, I am a nursing student, that is the day you have already started preparing for that board exam. Okay, so I expect that by the time you're like 5 or 4 months before your exam, you should already have some knowledge. There are some things you should already know. As you know, it's like there are some things that if they wake you up from the dream, you should be able to like answer some questions. If you're completely blank, if they ask you anything about nothing and you don't know, even when they wake you up from your dream, something is wrong somewhere. So that is established. If you're already close to the exam, it means that you already have some knowledge. You've done a lot of clinical hours and you've been in several classes, you have done several school exams, school tests, you've done several essays, several assignments, and you're already getting ready to become a nurse. So should you just stick to textbooks, or should you just do practice questions? Now, this is the method that I used when I was taking my exam, and I would advise. I advise people to start with their textbooks first, then move on to past questions towards the exams. And this is why I came up with that. When I wanted to start preparing for my exams, now I wrote my council exam in 2019 for nursing exam, and I wrote my midwifery exam in 2020. When I started preparing for my nursing exam in 2019, I started with past questions first. And I realized that a lot of things I was going through in the past question, I did not understand them. Not because my lecturers were not good, not because not because I didn't attend classes, not because I had terrible lecturers, or because my school was not good enough. I just realized that the way the questions were said, some of them, I was just not familiar with a lot of things that I was going through. And obviously, that was because I started trying to prepare for my council exam, like even a year before the exam. I was, should I say overzealous, or should I say I was an over-savvy student? That's just it, basically. That was what I was doing. So I realized that there were a lot of topics, even courses that had not started, because I wrote my exam in 400 level, and there were some courses that I even did in 500 level that were already part of the exam I was preparing to write while I was in year 4. So, there was a lot of over syllabus. That's what we call it, like over syllabus that was in the past questions that I was studying. So I had to go back to my textbooks. And there were also a lot of things in the past questions that I had learned. I'm very sure I had learned, but I'd already forgotten, like things from anatomy, physiology. So I had to start revising from my textbooks first. So I did it in a way that I combined anatomy, physiology, method, and pharmacology together. So let's say this morning I revised the heart. Maybe tomorrow I revise some physiology about the heart, blood pressure of the heart, conducting system of the heart, ECG and other things like that. So maybe sometimes during the week I just go through some cardiovascular issues like hypertension. I go through heart failure and all those things like that. In fact, pericarditis, infective endocarditis, and all of that. Then, while I'm reading each of those conditions, I am reading medications that I used in the treatments. I'm reading about diuretics. I'm reading about antihypertensives. I'm reading about several medications that I used to treat cardiovascular conditions. So that is how I move it. So if I do cardiovascular system revision this week, I can do like for 2 weeks. I could do like genitourinary system for like another 2 weeks. Then go over maybe digestive system for another 2 weeks. Learn about vitamins and all of that, bit by bit by bit. Then when the exam started getting closer, I started going through past questions. Now this time around, I had revised a lot of things. I've also been going to like classes, which was like I was already taking the courses that would have been over syllabus, some of the second semester 400 level courses. So my brain was already cooking. Or that was the term I used then. So at that point, it's more like you are cooking the raw part of your brain. You're trying to like you're starting the engine of your brain. You're trying to like gear your brain up. Then when you now start taking past questions is basically to teach you how to answer questions in the exam. That is like the best way to attack past questions. You don't cram answers of past questions, because one thing about nursing is that you may read all the past questions in the world, and that year will be the year they will decide, oh, okay, we are not repeating any past questions, we're giving you fresh questions. So what are you going to do if all you have been doing while you were studying is cramming past questions? Of course, while reading through past questions, there will be questions that will come up multiple times, and once you see it, oh, you already know the answer. But the point of reading your textbook first is for you to understand the rationale behind why that option is the correct answer. So when you're going through past questions, you will understand how to attack multiple choice questions, how to pick the most correct, because there's something about nursing objective questions. You could have a question and all the objectives are correct, and in that point you have to pick the most correct option. So what you're doing with past questions is knowing how to answer questions and understand the structure of the nursing council questions, like how do they come in. For example, when I wrote my rule, we're still doing objective and theory. I am aware now that majority of the questions are objectives. So when we did theory, then we already knew that okay, if they're going to ask you a question in cardiovascular system, obviously the beginning of that question is going to be about the anatomy and physiology of the cardiovascular system. You're also going to be answering questions on pharmacology related to the cardiovascular system. Then you have to write short notes. You already know that if you're writing short notes, you dare not write 5 lines. You're going to write at least 10 to 15 lines for a short note. And if it is 5 marks, just write a full page. So we already knew how the questions were set. We already knew that okay, everything is not going to be the same thing. You cannot have like anatomy and physiology from the beginning to the end. And we already know okay, there will be 5 questions, probably you have to answer 3, or there will be 4 questions, you have to answer 3. You already know the structure of the exam and you were prepared. One thing you need to understand that it is not possible for you to read every course, every subject, paper to paper before your exam. There is no way. There will be things that you miss out. You can't read, if you're reading the textbook, you can't complete Funas and Sudas, complete like pharmacology, like complete everything from back to back before the day of your exam and still remember everything. No. You have to be Kyle XY or you have to be an alien. I'm not scaring you, but it's just simple fact. There will be some things that you miss. But what is important is that you understand the fundamental things, the likely questions, the question structures, and how to answer them. So my best advice is that you start your preparations by revising with your textbook first. Then maybe like a month or a month and a half to the exam, you start to study past questions. So if you're looking for study plans on how to prepare for your exam, I actually have one one 3-month study plan for nursing students and 1 month study plan for midwifery students. And the way the study plan is set, it starts with the textbook. Then towards the end, you would have days set aside for practice questions. It gives you like a suggestion of topics. Like I arranged it to cover the important things you will need to study for that particular exam over a period of time. Like you have like 2 things to study in the morning, in the afternoon, in the morning, and in the evening. So it's more like an already set timetable. Then gets to the points towards the end of the exam, towards the weeks of the exam where you do past questions and also re-ask for OSCE procedures. And then finally, I think I also included some time for resting because obviously you also need to rest when you're preparing for your exam. If you need to get the study plans, I'll leave the link to them down in the description box below. If you want to start preparing for your exam and you want to start watching some tutorial videos, basically it may be about med surg or pharmacology, I'll leave the links to some of my playlists on the screen, and I'll see you in my next video. Bye.